Hi, my name's Phil. I like talking about politics, and in this video, I'd like to discuss Boris Johnson's latest statements about the need for action on the relentless rise of COVID infections in the UK against the background of verifiable facts. But first, if you'd like to be notified of daily news in politics, please subscribe to the channel and click the bell notification icon. So the recorded 7-day moving average for new infections per day has increased by 64% in the last week. Now, I want to start by explaining how serious this is. I've been looking at the percentage change in new infections over the past few months. So as we approach the end of summer, in order to see how various government policies impacted our infection rate, the infection rate rise, it went up and down as various conditions changed. It went up when schools reopened without a face mask mandate or proper ventilation. Slowed down a bit as a combination of things is, first of all, the infection rate rose to a certain point. Then you ended up with loads of kids becoming infected, having to spend time off school, same with teachers. Because that's one thing to take note of. Ministers talk about the importance of kids being in school. Now, as a former teacher, I absolutely agree with that. However, you have to make them safe. When you don't, you're not keeping the kids in schools because it results in both teachers and kids being stuck at home, ill or isolated. So keeping schools open, but without very obvious safety measures, means that you aren't keeping kids in school. There have been times when schools have been open, but a large proportion of their staff and students have been at home. The half-term break obviously also led to a reduction in cases. Then it started to creep back up again, and it was steady. Though at a high level, again, it's not always about just the increase or decrease infection level. That's what I'm showing here. But it's also about the level of infections. It's ours have been unacceptably high for months. We've had about 1,000 people a week dying from COVID since September. I wonder how many of the general public are even aware of that. But then Omicron came to the country. We did very little. Let's wait and see. Then we waited and see. We eventually put in a mask mandate into a small number of settings, which should never have been taken away in the first place. The rate of infections increased by 12% in a week. Then again, the following week, another 12%. Then in the last week, it has jumped by 64%. That's this vertical line now we've got. And that should be horrifying to anyone thinking this through. And all the more because the government are doing very little to stop it. Something else to bear in mind. We've reached our testing capacity now. There are people who can't get tested or can't get their tests processed quickly. Because run out of both the ability to get tested as well as lab capacity. That means a limit on what the recorded rate can even be. It's like Donald Trump used to say, well, if we don't test as many people, the numbers won't be as high. No. Obviously, we know that the recorded rate is always lower than the real rate because, there's going to be a lot of people who don't get tested. Maybe it's because they don't have symptoms. Or maybe they do have symptoms, but they don't suspect that they're the symptoms of COVID. And we have to remember now, symptoms of COVID are you feel ill. It could be any sort of symptom. Or it could be that it's a conscious decision. They can't afford to be off work with our slave wage level of statutory sick pay. And so they brain tricks them into thinking it's probably just something else like a cold or something. So they don't get tested. But the point is that monitoring the trend now is going to be comparing apples with oranges. It could look like it's levelling off and it might not be levelling off. If we cannot massively ramp up our testing capacity, we're going to be missing way more infections. And we could do that, but we're not going to, I suspect. The direct result of that is fewer people will know to isolate. That means more people will become infected than would ordinarily have been the case. And we end up with more hospitalizations as a result. Now, more hospitalizations means more NHS staff becoming infected and being off work. Demand on hospitals goes up at the same time as the supply of staff goes down. That means that fewer people get the care they need, even if they get to hospital. They can cope with fewer people. And it doesn't matter whether it's COVID or for any other serious condition. More people will die as a result of not getting that care. And more people would have died anyway, even without the pressure on the hospitals, because even those who are vaccinated are much less likely to develop a serious illness from either the COVID variant, whether it's Delta or Omicron, if you massively increase the number of infections, you massively increase the number of deaths. Even if you say, well, now that we're all vaccinated, there's a lower chance of dying. Okay, but it's still linked. The number of infections is still linked to the number of deaths. If you double the number of infections, you double the number of deaths. And there's a delay, of course, between infection, hospitalisation and death of several weeks. And the problem is that this is growing so quickly. The government and public seem to care only about hospitalisations and deaths. But by the time those figures go beyond your threshold of acceptability, and I'm afraid our threshold seems to be ridiculously high, it's too late for any moves to make an immediate impact. Because even if you go into full lockdown, oh no, the hospitalisations, all the deaths is now really serious. It's like, okay, but you now let the infection rate get so high, that massive infection rate is still going to translate into hospitalisations like a week or two later, into deaths another week later type of thing. Those deaths will carry on rising for a while longer. And before I go over the government's latest grievous error of judgment, I want to highlight something else. Because the scientists are crystal clear that we needed strong action as soon as possible. We've already gone past the point. We need it. The Tory MPs who are opposed to any measures are trying to disparage their conclusions. MPs without the ability to even read a pie chart are somehow able to tell professors that there's something wrong with their complex mathematical modelling. And the fallacy works like this, and you'll have seen it yourself on social media. Oh, you did this prediction before and it turned out to be a massive overestimate. So your models they overestimate the risk, so we don't believe them. That's what's happening in their heads. Now let me explain what's really happening. The scientists aren't producing predictions. Whenever you see someone posting something, oh, this was their prediction, they never produce predictions. They produce forecast models. Now what a forecast model is, it takes a bunch of parameters and says what would happen if those parameters are true. Now, here's what happens is, the worst case scenario is where them saying, right, these are the parameters where you do nothing. So they say to the government, we're modelling the parameters where you do nothing at all. This is what happens. And the government look at it and they go, oh, that's a bit costly. Don't like the sound of that. And they implement measures to curb the rate of infection. May not be enough, may not be soon enough, but they implement something. And they've done that recently as well. It's not enough. The plan B is not enough, but it is something. So the parameters change from the forecast model because now, instead of it saying what would happen if we did nothing, we have done something. So the COVID deniers always try and slate the scientists by mapping their worst case scenario, which is doing nothing, onto what actually happened as some sort of proof that they got it wrong. They didn't get it wrong. If you map their model for the parameters that were adopted, they've actually been spot on. And what's more, the government know this as well. Like, they choose their scientific advisors. Yes, there are independent ones like Professor Christina Pagel, I follow quite closely, but they have their own scientific advisors and they choose them. If those advisors were constantly getting things wrong, they would get rid of them and get some different ones in. They've got a wide choice. So yesterday, Boris Johnson confirmed what we knew he was going to say anyway. There was not going to be any restrictions in place until Christmas at least. Now, you can look at this decision two ways, both of which are very bad. The first way is that Boris Johnson doesn't want to tell people that they can't meet up on Christmas Day, but maybe afterwards they'll swallow it. However, a lockdown this week would have been the best way to save Christmas Day. Like, if we locked down for 4 or 5 days at the start of the week, then way fewer people would be out and about getting infected. You could have done that for 4 or 5 days and then said, right, Christmas Eve, Christmas Day and Boxing Day, you can then meet again and then back into lockdown. So there'd have been lockdown, you're not out and about as much, fewer opportunities to become infected. And when the chance for infection is massively reduced, so is the actual spread. So we'd get the rate of infection right down. That means of the people meeting up on Christmas Day, for which the lockdown, as I say, would be lifted for a few days, fewer people would be infected and in a position to pass that infection on to their fellow feasters. Last year, people had Christmas gatherings and it resulted in the infection and deaths of a lot of vulnerable friends and relatives. I really feel sorry in many ways for people who are going to have to look at that empty chair this year and know that they did that. Know that they did it. This year, the same is going to happen. And the Prime Minister knows it. His Cabinet knows it. All MPs know it. This is because the Cabinet had a meeting with the Chief Scientific Officer and the Chief Medical Officer, the Chief Scientific Advisor, and the Chief Medical Officer, who explained to them in really clear language and answered all their questions. Then they had a meeting for any MP who wanted to attend it. Remotely, of course. So they have had it explained to them and had all their questions answered. There can be no complaint of ignorance over this. No complaint of, we didn't realise. Did realise. They've been told. They've been told and had the opportunity to ask any questions of our senior experts. But what worries me more is that Johnson didn't make this decision because he didn't want to ruin Christmas. That's what happened last year, even though this is doing just that. He's done it this year because he's lost his authority. The roughly 100 Tory MPs who tried to oppose our already weak Plan B measures have clearly made certain threats to Boris Johnson and maybe other cabinet ministers. Reports suggest that if Johnson even tries to implement more measures, that there will be cabinet resignations. Now, because this is the pressure you can put on a cabinet minister here. Everyone knows Boris Johnson's going now. It may not be soon. It may be months. It may be summer. Who knows? But he is definitely gone now. He's lost all credibility. The polls are just tanking for him in terms of his personal approval ratings and the Conservatives in general. So you can see what these 100 MPs will be doing, going to cabinet ministers, some of whom will be interested in taking over and going, well, if you want our support, you'd better support us. You scratch my back, I'll scratch yours. We do not want any more restrictions. So there's the pressure on those cabinet ministers. Now, I don't know how much of this is true, because a lot of the Tory press have their own agenda to push. And when they make unattributed statements that support their own political bias, you'd need to be a bit sceptical. You do get a lot of a feeling for what's going on amongst Tory MPs. They're feeling from journalists, and obviously they don't directly attribute it. And you sort of go, oh, that's interesting. But when it's something like this, like Boris Johnson is held hostage by a minority of his own MPs, a large minority, but still. The fear is he won't even apply more measures after Christmas if they don't agree. And we're getting the impression that they won't agree. But I can't possibly know until we get there, because like I say, this is a topic that the Tory press also push very hard. So I don't find them at the moment a reliable barometer of the mood of Tory MPs right now. And this weakness is costing both our health and our economy. They always say, oh, go prioritise the economy. They're not doing that either. Because the government won't announce a lockdown, there's very little business support. But because a lot of people will stay away from hospitality businesses in particular, they're going to be losing lots of income. And for a sector where the profit margins are often quite low, that could be curtains. Same with entertainment, like theatres and so on. And the Chancellor has announced £1 billion of support, as if that sounds useful. As if it sounds a lot. Oh, if I had £1 billion, that'd be a lot. And I've said this before, the government often announce sums of money that sound like a lot. Like £1 billion sounds like a lot, but for a whole country, it's not. They're actually worthless. Like our GDP is about £2 trillion a year. £1 billion, that's 4 hours of our GDP. Now, of course, not all sectors of our economy are hit. It doesn't need to go to everyone. I mean, you would think hospitality, transport, the performing arts, they'd be the worst hit. But even taking those sectors, that £1 billion barely covers a day or two of lost earnings. And that's assuming that the application process for the money will be straightforward. Because you drill down, and Rishi Sunak said businesses could claim up to £6,000. Well, for some businesses, like I saw one person in the hospitality industry saying that's like a night's worth of takings. Now, okay, it's not supposed to replace the takings, it's their outgoings. But like I say, often tight profit margins. So, it only covers a couple of days potentially of lost earnings. And I bet the process isn't straightforward to access it even. But the cost to our health will also be extreme, because as a result of the government's decision this week, many people will die. Frankly, allowing the infection to get as high as it did and stay as high as it did was an epic failure of leadership. Allowing it to rise beyond our testing capacity nearly 2 years into the pandemic should be unacceptable to everyone. But the prospect of, even after their precious Christmas, or Death Day as it will soon be known, the prospect of still not applying strong measures even after this weekend is horrifying. But those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button if you'd like to support the channel further. Please also click the Patreon link for details. And until next time, I'll see you later.